So South Africa is officially in a second wave of COVID-19 infections, but what does this actually mean? And are we likely to go into a hard lockdown once again? Let's talk to SA Medical Research Council CEO, Dr. Glenda Gray, who joins me now. Dr. Gray, thank you so much for your time and good morning to you. Yesterday, Dr. Willem Kiese made the announcement we are officially in a second wave, and I saw a bit of a debate even on social media with South Africans wondering what's the difference between a resurgence and a second wave? What dictates a second wave?
Well, I think a second wave is when you hit a certain level of infections that you've determined, and we went over 6,000 yesterday, so we were in a surge, and I guess technically you determine that you go into a second wave at a certain level of infections. But we have been, our numbers have been increasing over the last 10 days. We've seen increases cases in the Eastern Cape, in the Western Cape, now Gauteng and KwaZulu-Natal. And so this is bound to happen. Without a vaccine, we are going to be having surges, resurgence and waves until we can eliminate this virus with a vaccine. It's very hard. The tools that we have are quite rudimentary. They're very blunt. Wearing masks, physical distancing, maintaining your space and washing your hands, avoiding crowds and congestion are quite blunt in comparison to a potent vaccine.
Now, Dr. Gray, even during the statement, the minister spoke about how the age distribution has shifted from the norm, the age group 15 to 19 now showing the highest number of cases over the past 2 cases, obviously attributing that rather to the recent Rage Festival being a super spreader event. Does that mean that that group is more at risk, or does it mean that everyone is still at risk, but it might be that particular age group that is showing those high numbers at this moment?
So we saw the same thing in Europe and in the US in summer, where the second wave was promulgated or started by young people. So young people have pandemic fatigue. They've been locked down for this whole year. It becomes summer, and it's to be expected that they will go out and behave irresponsibly. So what we have to do with that group is to make sure that parents, people in facilities that are housing them, ensure and that they practice non-pharmaceutical interventions and that they behave themselves and behave more responsibly, because these youngsters come back and they infect their parents and their elderly relatives, which can cause huge issues like more hospitalization and death. And so the young people will feel the epidemic at this moment in time, and we have to try and support them in wearing masks, keeping distance, washing their hands, and not being in congested areas. And people, patrons at bars and bar owners have to make sure that they can support young people in implementing these interventions to protect and not only themselves, but their families and relatives.
Yeah, so it seems behavior here plays a huge role in where we find ourselves in South Africa right now with the second wave, Doc. But, what do you advise should be the next step? I know that the minister said, Cabinet still needs to sort of get together and plan on what the next steps should be. There was conversations about, or the questions on, will a second hard lockdown be imminent? What's your advice from a medical perspective?
Well, our job is to keep the hospitals open and to keep our healthcare workers not tired. And so we're seeing a lot of fatigue amongst healthcare workers. We're seeing the healthcare workers getting ill, and we're also seeing our hospitals filling up. And so the best way to manage hospital admissions is to implement things like curfew, so that there's less time to mix after 10, which means that you can prevent transmission for about 10 hours every day. So curfew is a good intervention to help not only prevent onward transmission of COVID-19, but also to prevent hospitalization due to alcohol-related trauma and trauma that happens when people are speeding at night. And so we do know that when you implement a curfew, that you do reduce trauma-related hospitalizations, and you give healthcare workers a time to breathe so that they can manage the COVID-19 infections that are coming in. So the other thing is to make sure that bars and restaurants and clubs implement good ventilation techniques, that they insist on people's not being congested and overcrowded, and that they manage alcohol use in the club so that people don't lose their inhibitions. And so there's a lot of things that we can do as society to prevent any hard lockdown. And a hard lockdown is the worst thing that can happen to this country. And what we have to do is appeal to the public and to people who are in the hospitality industry to try and implement these interventions.
And Doctor, just before I let you go briefly, please, within these 4 provinces that the Minister has mentioned where we're seeing the second wave, are frontline healthcare workers equipped with the necessary PPE? Will our health facilities be able to handle these new cases?
So the healthcare workers are tired. They've had a very hard year. And we do hope that they have sufficient and adequate PPE and they have sufficient numbers. I have heard of a lot of doctors being infected at the moment and a lot of nurses. And so we do have to make sure that in their line of duty, they are protected and that they have adequate and appropriate PPE and as well as adequate staffing. Because the worst thing that can happen is if we have fatigued and overstretched health facilities, because it not only will affect COVID-19 infections, it will affect other admissions and other hospitalizations.
Well, Dr. Glenda Gray, thank you so much for your time.